You might notice something different the next time you go to the doctor's office.
As we continue our Eye on AI series, CBS 58's Pavlina Osta shows us how healthcare leaders are developing new ways to improve patient care and also lower costs.
Any doctor who could be replaced by a computer deserves to be replaced by a computer. The issue is we're running into a math problem where doctor time and availability is becoming more scarce.
Dr. Bradley Crotty is the Chief Digital Officer for the Freighter and Medical College of Wisconsin Health Network. He's also the interim president of Inception Health.
We're using AI in a couple of different areas. One is to help clinicians and patients focus on each other and not the electronic health record and the computer.
Like many industries, AI integration is relatively new, but Dr. Crotty and his team
Show me my last note.
Are already piloting AI in the office.
Patients may start to see that we have ambient recording where a AI tool is helping to record the conversation and create the note for the workflow. And it helps the patient and it helps the clinician so they can work together. So that's an example where you can see that in the office today. Show me the follow-up visits for this patient.
Here are the recent visits.
Dr. Brian Kay is the Chief Strategy Officer at Roger Behavioral Health and says AI can predict the risk of suicide with inpatient care adults.
When we apply AI to it and start looking at different data that's contributing to suicide risk, we start uncovering things that may have not been associated in the literature previously. And where it gets really exciting is then you could build different models with that of starting to associate risk with an individual, so you could build different interventions and more personalized interventions.
But while artificial intelligence may bring up some scary thoughts, Dr. Kay says his team is keeping a close eye out for misinformation.
We always ensure that there is intent, so our docs are reviewing it before anything makes its way into the medical record. So we put some of those guardrails in there to make sure there's a human touch.
Dr. Crotty says one hope with AI is that it will make healthcare more affordable.
That's where we have to get. We have to be using technology to drive down the cost of care.
A single photo from your smartphone can save you a trip to the doctor's office.
Being able to look at the back of someone's eye with a picture as a visual and be able to have the computer tell you, is there an eye problem or not?
Dr. Crotty says the healthcare industry is integrating AI at a slower pace than other fields out of caution, but ultimately wants to see AI bring back face-to-face doctor-patient interactions and create a better support system for patients after they leave the hospital.
It should be a tool that helps us all do our better job at lower cost.
In Milwaukee, Pavlina Osta, CBS 58 News.